Hospitals and imaging centers across the state are being forced to ration vital medical scans and procedures.
This after a General Electric plant in Shanghai, which produces a widely used contrast dye, was put on lockdown.
The dye is used for a variety of purposes, many of them life-saving. Because of the shortage, hospitals and imaging centers are now being forced to use alternative tools when appropriate that don't require the dye.
KITV4 Cynthia Yip now joins us live from Laliha tonight. Of the 28 hospitals in Hawaii, 16, including St. Francis Medical Center, have CT scans. There are also 6 freestanding imaging centers, and all are being greatly impacted. Cynthia.
That's right, Rick and Mika. When I talked with the CEO of the Radiology Center here at St. Francis Medical Center, and he says that any kind of delay in care is urgent.
The increased contrast helps doctors easily diagnose a brain bleed or clot, see how a heart or other organ is functioning, or determine whether a tumor is growing or shrinking, among other things. Because of the shortage, hospital systems in Hawaii are deferring non-urgent medical procedures and using alternative imaging and diagnostic tools that do not require the dye when appropriate.
It's definitely going to affect some of our patients and delayed in making those diagnoses, and that's where the concern is coming from a lot of the patients and a lot of our physicians, because a lot of them come with pain, with some kind of illness that needs to be treated right away, and not having the contrast available is going to make that diagnosis a lot more difficult, and we may not be able to see what is actually causing the problem.
Miyoshi says Hawaii Diagnostic Radiology Services has a very limited supply of contrast dye at their 3 facilities, including St. Francis Medical Center.
But right now, I know that even with the number of orders that we have coming in, we just don't have the contrast needed to see all the patients.
The Healthcare Association of Hawaii represents the state's healthcare providers and met with them last week to manage and conserve the use of the contrast media.
And so that meant that there is a international shortage of this particular media for CTs, which is very, very problematic because the CTs are used for a variety of imaging needs and very, very widely used. We do want to ensure that anyone who has an immediate or urgent need for a CT with contrast does get that scan. So we're ensuring that we are conserving supplies of the contrast media, we're prioritizing supplies, we're deferring those CTs that are not immediate or urgent.
Now, the plant in Shanghai may be coming back online in a couple of weeks, but the Healthcare Association of Hawaii says that local hospitals and imaging centers will not be able to get their full supplies of that life-saving dye until that time. Reporting live from St. Francis Medical Center, Cynthia Yip, KITV4 Island News.